According to the World Health Organization, the WHO, Grenada is suffering a similar fate to the rest of the Eastern Caribbean, where the rates of overweight and obese children aged 0 to 4 years have doubled from 7.4% to 14.8% between 2000 and 2010. The rates, according to the WHO, are higher in older children. A wide cross-section of persons was involved in the discussion on Thursday, ranging from school children to representatives of the Royal Grenada Police Force. Chair of the Commission, Damien Greaves, says the session was aimed at developing a strategic plan on the prevention of childhood obesity.
Evidence dictates what we are doing in that 1 in 3 children across the region is obese and overweight. And Grenada's scorecard is not far removed. Over 25% of our children, 26+% of our children in Grenada are in fact regarded as obese and overweight. That spells disaster for various levels. Level 1, for the individual. When you become an adult, you will become prone to chronic diseases and certain cardiovascular diseases, your diabetes, your hypertension and so on. At the level of the community, in terms of the society, at the level of the household, in terms of what you eat, what you consume, the sugar sweetened beverages, the sugar sweetened juices. At the level of the community, in terms of how you can move regarding the development of the community, and finally at the level of the country in terms of the productivity and the wealth that you can generate. If your productive sources, that is your human resources, are afflicted with chronic diseases through obesity at this stage, age 5 to 19, then you can understand that the productive forces in the 20s and 30s and 40s will be severely hampered in terms of what can be produced either by sickness and days absent from work, or lethargy at work, so you cannot produce optimum or maximum, and therefore it's going to hurt eventually the productivity and wealth of the country.
Focal point on the commission, Senior Medical Officer Dr. Sonia Nixon says this would not be another document for the shelves, but one that will be fully implemented with support from the Ministry of Health.
So today we should come up with a plan and a plan of action. Hopefully it's not going to be on a shelf, because here we have all the stakeholders which we hope to engage beyond today. We have children, we have primary and high school children, we have community college students, we have their teachers, we have retired teachers, we have parents, grandparents, people in the private sector, we have insurance companies, we have the police, we have a lot of people, and everybody has a role in ensuring that this whatever we amass becomes very organized and is worked out in the interest of our children, and in the interest of not just our children, of our country's future. We're losing our people too young to chronic diseases that are in fact preventable.
The Commission says the solution should include primary health care, promotion of breastfeeding, healthy eating, and focus on school food and physical activities. Eugenia Peters, GBN News.